livingalonger.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, Living a Longer and Healthier Life. Tonight, we're going to be talking a little bit about anti-aging medicine, functional medicine, so that's a new term for me to learn right on the fly tonight, which is great because I'm always learning a ton about healthcare and laser surgery as well. Big shout out and thank you to the sponsor, All County Healthcare, for sponsoring this show, the You and Your Doctor Show, Living a Longer and Healthier Life, every Tuesday, 6 to 7, right here. Whether you're catching us on Facebook Live or on the radio, driving around. And it's been quite a day with the weather today, and I'm going to go ahead and share from my Facebook Live page right now. But the weather today has just been something else. I didn't see that one coming. I actually was driving to a hospital today to interview a patient for a testimonial, and what had happened was I saw lightning right in front of me, and I don't remember the last time that I saw lightning in South Florida. So be careful if you're driving around out there as well. And always be careful when driving, of course. And I want to thank our doctor today, first off the bat, for driving up from West Palm Beach, Dr. Daniela Dadurian. And thank you for making the drive all the way here to Boca Raton. I appreciate it.
Thanks for having me.
And let me start out by asking you, what is your specialty? Because we talked a little bit about functional medicine, and I think that's a great term, but not one that I know too much about. So let's start out with, what is functional medicine, and we'll talk a little more after that.
Well, my initial training was in internal medicine, and what really happened was in 2001, my father died of lung cancer, and I really didn't want to deal. It was very emotional, difficult for me to deal with chronically ill patients. So I felt there should be a better way to handle aging and more try to promote and achieve healthy aging and prevent disease. So it really prompted me to look into the term functional medicine, where you're trying to prevent illness, prevent chronic disease, stay healthy, and maybe approach some diseases trying to stabilize them or cure them with more natural remedies.
Would you say that falls kind of under the holistic umbrella of medicine?
Yes, definitely.
Okay. We're seeing a lot more of that, to be honest with you. 5 years ago when I started in healthcare, I didn't know anything about holistic medicine. I didn't even know it existed. To be honest with you, I didn't even know what yoga was 5 years ago. So I know doesn't fall under there, but it kind of falls under that same.
Yes, I went to medical school at University of Miami, and that's where also I did my internal medicine training. And at the time, we didn't have anything like that. Now they have a whole department at the University of Miami that
holistic medicine.
Yes.
Wow.
Trains in
Now, did
medicine.
you train at University of Miami? So did you train a bit at Jackson Memorial then?
Yes, I did. Yeah.
The big hospital? Mm-hmm. We talk a lot about that on the show. It seems like the great doctors who come through the studio twice a week, a lot of them trained at Jackson. And I didn't realize, I had driven by it on my way down to, see the Miami Heat or the Miami Marlins baseball game. I didn't realize, I saw it was a big hospital, but I didn't realize how many beds. 1,300 beds right now.
Yes.
It's got to be one of the biggest hospitals in South Florida, if not the biggest. But you trained there, so you were on a path to internal medicine. And did you finish that training and then go into functional medicine? Or
yes, I finished in my residency in 1997, and I moved to West Palm Beach. I took my first job in an internal medicine practice. And then I opened my own practice in 1999. And I started branching off in 2001 into this field.
Nice. Wow, so you're kind of like a pioneer, because that's a good 17 years ago. And like you said, like I said, I hadn't even heard of that type of medicine before then. So at first, was there a lot of explaining to people like me the difference?
Definitely, yes.
Okay, nice. So there's a lot of education involved.
Yes, but now it's very, very popular. People are patients are extremely aware and very educated.
Now, tell us a little bit. Now, you were telling me in the green room before we came in here, you have 3 offices, one in Palm Beach, so on the island of Palm Beach?
Yes, I do.
Nice. And then 2 in West Palm Beach?
Yes, so I have one office, my original office is in West Palm Beach on South Quadrille Boulevard, and it's mostly a minimally invasive cosmetic practice.
Okay.
I do a little bit of anti-aging medicine there too, but it's probably 90% cosmetic. I have a second location on the island of Palm Beach that's also mostly cosmetic. And I have recently opened an office on North Olive Avenue in West Palm Beach that's almost 100% dedicated to wellness and anti-aging, which is very exciting to me.
Whoa, those are my 3 favorite areas of Palm Beach and West Palm Beach that you just mentioned. And we'll give out that info during the show because we're lucky enough to have Dr. Dadurian with us for a bit longer than normal tonight. She agreed to stay. So I'm going to mention all that as well. But if you have any questions in the meantime, you can check out her website. It's mdbeautylabs.com. Or call 561-655-6325 tomorrow or anytime and learn a little bit more. But you have this great article that was published in the North Palm Beach edition, the March edition of Health and Wellness, which I see everywhere. I pick it up everywhere. So kudos to you for getting the word out in there. And it's a great article. I like the graph that you have in there, or the art that kind of explains life-sustaining benefits of NAD. And right off the bat, I had a little question because I don't know what NAD is. To be honest with you, I didn't do my research on that. So, what is NAD and why should we be concerned about that?
So I'm really excited about this treatment. I feel that as of right now, it's the most cutting-edge treatment somebody can receive in terms of staying healthy and anti-aging. Mm-hmm. NAD stands for nicotinamide adenine dinucleotide, and it is the cofactor that is necessary for DNA and mitochondrial repair. I'm sure you've heard of vitamin B3 or niacin. Mm-hmm. It's the coenzyme of niacin.
Okay.
And it's the molecule that's required for the mitochondria, which are really the powerhouse of the cells, to be repaired. So that really means that the applications are endless, from neurological disorders to autoimmune disorders, even cancers. It basically repairs every single cell in your body.
Now, is this something that we can get our own from food, or is the body not getting enough from the daily diet, or maybe someone, with a horrible diet?
Really, it's kind of like hormones. You have very high levels when you're young. Mm-hmm. And then NAD levels start declining. By the age of 50, you have about 50% of the NAD that young people have. And mm-hmm. probably by the age of 80, only about 1% of NAD is left in the body because we don't really produce it anymore. So one train of thought, and there's a lot of research that has been initiated in this field, is that the declining levels of NAD, since we're losing the ability to repair DNA and cells, really can be linked to diseases associated with aging, because we don't have the molecules around anymore that would be repairing DNA mm-hmm. strands and the cells.
I see. Now, you said something interesting there that I kind of hit on is, so this is, NAD is made by the body. It's a hormone. It's something that the body is making.
It's not a hormone, but it's kind of like a hormone.
Okay, kind of like one.
In that the levels go down as we age.
I see. Okay, but it is made by the body then?
Yes.
Okay, so like you said, when you're younger, we may have higher levels, but as we age, those levels maybe go down, and that's where someone like with the training and education you have and that experience since 2001 can help bring those levels back up.
Yes.
NAD
as in supplement form is not stable, and it mm-hmm. doesn't get absorbed. So really the only way to administer it is intravenously.
Oh, so this is something that we can't take as as a pill form?
No.
No. Okay, intravenously. So is that where IV therapy comes in?
Exactly.
Wow, and that's something that can be done in your office?
Yes, that's what I predominantly do in my new location, in my wellness center on 1000 North Olive Avenue.
Okay, yeah, the one right downtown.
Yes.
As well there.
Right by Good Samaritan Hospital there.
Oh, good. Yeah, I'm actually, my daughter was just born there 9 months ago, so I'm very familiar with the hospital. And my sister was born there. I was born at Palm Beach Gardens Medical Center, but that's another story for another day. But yeah, that's right downtown in the heart of it. What a great area. A lot of building going on down there.
Yes,
every time I go there, it's that and Miami are in this humongous building boom. It's like they're competing with each other.
Yes.
I think Miami's winning though. And then you got the train now too, so you're going to be able to take the train. I asked for a ride on the train.
That's right outside my office.
Oh, really?
One of my offices.
Have you taken it yet?
Not yet.
I asked for a ride on it, Brightline, and I know they took the bigger media in there. I still haven't got my media ride, because I was going to write about it. But I am meeting next week their PR person.
Come by and visit.
Yeah.
It's right across from my office.
I will. Yeah, I'm going to the Gold Coast PR Council, and the PR person for Brightline will be there as well. I would think for doctors that's going to be great when it's all hooked up, because you can take a train to Miami and work on the way, right?
Right.
Maybe look at some charts, maybe come up with the next thing that you can offer the patients, and as well. So I was a little off on thinking NAD would be something supplemental, but it's injectable. But one of the things important when you're getting injections, how important is it to have a staff or someone trained in medicine to do injections? Because I know sometimes these IV places are popping up. Some people go after hangovers kind of thing. It's kind of like the new thing.
I have highly staffed, highly qualified staff. I see all my patients myself. I do the initial consultations, and I have a nurse practitioner at the Olive location where NAD is being administered, and she is there with the patients all day long and monitors them and
nice.
Makes sure that everything is fine and they're safe.
Yeah, nurse practitioners, and they're educated and trained as well. We've had a couple on this program. I'm happy to say we had a clinical nurse practitioner and one that sees patients in primary care, kind of internal medicine too. So, wow, you have your own in your office on Olive there. That's great to know as well. Where is the injection done? Is it done in the arm like an IV?
Yes, just like a regular IV.
Okay. What's the how long? When I need an NAD, how long does it take? How long am I in the office? Do different people vary?
Well, it all depends. The first day you go, it would take a little longer, maybe up to 6 hours.
Okay.
Because it depends on how fast it's running.
Okay.
And how well the patient can tolerate it. Some people develop side effects that would be could be nausea, could be headaches, could be some chest pain. And really, it's nothing dangerous. It's just a disturbing feeling, and it's dependent on how fast the IV goes. If patients develop those type of side effects, all we do is just slow down the IV. And then, of course, it would take a little bit longer. But really, nothing bad can happen.
Okay. It's how the body takes it at first.
Yes.
And the body gets used to it. Dr. Dadurian, hold that thought. We're going to take a quick break, and on the other side, talk a little bit about NAD IV therapy, a little bit more, I should say, on the You and Your Doctor show.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
That was strange.
And we're back on the You and Your Doctor show, living a longer and healthier life with Dr. Daniela Dadurian. And I hope I'm getting that right.
Yes,
Dadurian. Okay.
Absolutely.
You have initials DD just like me. I'm David DePino.
That's right.
So that's really neat as well. Now, Dr. Dadurian was telling us that she has 3 offices in South Florida. It's Olive Avenue. I'm going to give out the address, 320 South Quadrille Boulevard in West Palm Beach. You're also over in Palm Beach on the island.
Yes.
Where you do, correct me if I'm wrong, cosmetic. And then Olive Avenue is the anti-aging focus. Yes. And then over on Quadrille Boulevard, I know exactly where that is. I love that area near Clematis Street, is minimally invasive and cosmetic as well.
Yes.
So I got it right. We left off there on a little bit about the NAD IV therapy. And I won't try to say NAD. I'll let you say it again. But it takes, that first visit could take up to 6 hours because your body has to adjust to the IV therapy. And you take a slow approach.
Yes.
What can people do in that 6 hours? Because I know that's a question I'm going to be asking. They bring a book. Is there a TV?
So it's a little taxing. It gets a little boring. So we're trying to make it as exciting as possible. We have iPads with movies. We have a massage therapist that does mini massages, reflexology. We even have a hypnotherapist that can do some sessions, hypnotherapy. Wow. So we're trying to offer different little things. We serve lunch at lunchtime to make it a little more enjoyable and not quite as boring.
Yeah, definitely. That's neat. Like, you see that in some offices here and there, maybe an iPad here and there, but not like that. And to actually have someone in the office doing, you said massages as well?
Yes.
If that, okay. And that's really neat as well. So, kind of keep people, occupied because that first time is gonna take a little longer. Yes. And there, I'm having Freddie share it to your page as well, so we'll get the word out. Now, so it takes up to 6 hours the first time. Now, is there a certain amount of months or weeks go by before you have to come again?
So I'm kind of a pioneer in the anti-aging arena with NAD because NAD has really been known since the 1930s.
Oh, wow.
It's been used extremely effectively for drug and alcohol detox since the 1960s. And that protocol entails 10 days straight of NAD IV therapy. And the reason why it's so effective is because it actually crosses the blood-brain barrier and acts on the midbrain, which is really the craving center of the brain, and completely takes away cravings for alcohol and drugs. So it's been used for that purpose since the 1960s. Now, it's been found since that study at Harvard University that really it makes sense that it would be very effective in anti-aging and other disease states in general. So we're trying to come up with protocols. What would be the most effective thing to do for somebody, for example, who just wants to stay healthy and wants to prevent chronic disease. So what I am doing right now is blocks of 3 days. I would have a patient come in 3 days in a row and then break it up a little bit because it gets definitely too boring. Take a week break and do another block of 3 days, and then take another week off and take another block of 3 days.
Okay, so 3 in a row over a 3-week period.
Over 3 weeks. And then after that, just like anything else, you need maintenance, because if you don't continue with it, it will eventually go away. So right now, probably 1 day every 3 to 6 months is a good idea, just to maintain those levels up. And we also have now some creams that transdermally delivers NAD and maintains the levels, or nasal sprays and some sublingual tablets that dissolve in your mouth and help maintain the NAD levels in between the IV therapies.
The maintenance, you gotta treat the body and maintain it as well. I'm just gonna reference that article you mentioned. So the article is in the North Palm Beach edition of Health and Wellness. It's you write about David Sinclair. He's a PhD, a professor of genetics at Harvard Medical School. And you write a little bit about his study with mice that help mice become healthier and more youthful by restoring mitochondria in their muscles through injection. Now, I remember that term mitochondria all the way back from like 7th, 8th grade science. But how is that effective? How does that happen in the muscles? So the mitochondria take this NAD and kind of use as fuel?
Is the powerhouse of every cell, really. The mitochondria is the energy source of every cell. So this is where NAD comes in. NAD repairs the powerhouse of the cell.
And we hear a lot about that in all types of medicine as cell repair, how important that is.
Yes.
So here you got it right here on the You and Your Doctor Show.
That's what makes it so exciting.
Yeah. As well, do you do it yourself? And not do it to yourself, but do you use this kind of therapy?
Yes, absolutely. It's just that I have rarely time to be able to sit for 4 hours, so I usually do it after the office and I go home with it.
Yeah, there you go as well. Now, we're here with Dr. Daniela Dadurian, and the Harvard Medical School news from David Sinclair, the PhD, a professor of genetics there. I'm going to tell everyone where you can find it. Again, it's in North Palm Beach edition, March 2018 of Health and Wellness, SFL, healthandwellness.com. I imagine this will be up on your website as well. Mm-hmm. So the website is mdbeautylabs.com. Now, one of the things that I wanted to ask you about in this article is the term telomeres. Tell us a little bit about the telomeres and how they can, be used to help make you healthier.
So telomeres is, you could look at telomeres as the plastic caps at the end of your shoelaces that prevent the shoelaces from unraveling. Telomeres are those caps at the end of DNA strands that basically prevent the DNA from unraveling and getting damaged. So there is a study that has shown that the length of the telomeres, in other words, the longer the telomeres are, the less likely that the DNA will unravel and be exposed to damage. So it's really a measure of your physiological age. The longer the telomeres are, in better shape your DNA is, the younger your DNA is, as opposed to your biological age. So in theory, and I would like to really verify this in my own patient population, I would like to check telomere lengths before patients receive DNA therapy, and then afterwards, after probably a 9-day treatment of NAD, to see whether their telomere length has actually improved, because that would prove that we have actually repaired their DNA.
So that's like your own research study in a way,
Yes,
right?
Exactly.
So let me get this right. The biologic age could be different than telomere age. You could be hypothetically 50 years old, but your telomere age maybe
could be off a 90-year-old.
Yeah. Or vice versa. It could be lower.
Exactly.
If the the treatment works for you.
Exactly.
Now, do does it work for most people, or is that part of the study as well? I mean, do you have to?
It's really, I feel that I'm a pioneer in terms of the anti-aging arena. We've seen very good results, excellent results with drug and alcohol detox. Very good results with some neurological disorders too, such as Alzheimer's, Parkinson's disease. But in terms of anti-aging, it's really a very new field that we're just beginning to look into.
Now, is there a way to know if it's more effective in men or women, or is it something that...
No, there doesn't seem to be a difference between men and women.
And what about age? Like, is it something that if someone starts at a young age, it would be more effective if they kept going and maintained it, or does it matter, like you could start at an older age?
Well, really, this is what people more and more... We don't have the scientific evidence for it yet. But this is what more and more people are trying to do now, to do this type of treatments early on in life so that they prevent chronic diseases that would be coming on later.
Okay, that's good to know. We're here with Dr. Daniela Dadurian, and you're a medical director as well, and you're board certified in anti-aging medicine and laser surgery as well.
Yes.
Okay, so that's actual boards that you had to take, and then you have to keep up with, just like maintenance, you have to keep up with those boards, right? Certain things you have to do every year, or every few years as well. Now, another thing I want to talk to you about is neurotransmitters. Now, I know a little bit about those because I actually have had a couple neurologists on this show and have helped me explain it. Now, are neurotransmitters only found in the brain, though, or are they all over the body and other parts?
They're really signaling molecules.
Okay, signaling molecules. So they can be in the spine and the brain.
Right.
What about outside the neurological system, like in, I guess, the arms and legs as well? Okay, so they're everywhere.
Yes.
Now, you write a little bit about those. Now, what is actually a neurotransmitter from a clinical standpoint?
From a clinical standpoint, it's a substance. It could be a hormone. It could be a peptide that sends signals to neurons to do something.
Okay, I got it. And how can, with the NAD IV therapy, how can that help the neurotransmitters? Again,
it improves them. It improves their function.
Okay.
By repair.
Okay, again, it's cell repair.
Right.
Is what's going on. Wow, this is amazing. I've done this show for 2 years, and I've never touched on anything like this, like we're touching on right now with Dr. Daniela Dadurian. We're going to take another quick break. On the other side, I want to talk to you a little bit about why there are only a handful of physicians trained in this specialty, and IV fusion as well on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier. an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Show, living a longer and healthier life. We're here with Dr. Daniela Dadurian. She's an MD and a medical director as well at MD Beauty Labs, is a spa and wellness center. 3 locations in the West Palm Beach area. 2 are in West Palm Beach, 320 South Quadrille Boulevard, 340 Royal Point Sienna Way, Suite 325D in Palm Beach. I'll give that out again as well. And then you're over on Olive Avenue. I didn't jot down that address, but you're
1000 North Olive Avenue.
Okay, got it. 1000 North Olive Avenue as well. And at those locations, so in Palm Beach is for cosmetic. The Olive Avenue that we just mentioned is anti-aging, and at the Quadrille Boulevard in West Palm Beach, minimally invasive and cosmetic surgery as well. You do laser surgery too. Is that the cosmetic part of it?
Yeah, those
so you
are
use
the
laser.
Yes, lasers for all kinds of different purposes.
Okay.
Skin tightening.
Okay, a lot with
fat
the face.
Burning.
Fat burning too.
Yes.
Okay.
Body and face.
Can you help? You know, if someone's had, I've ran into this a few times. I do a lot of testimonials. I do a lot of writing. I'm a writer since professionally since 1999. But I run into some people who have had bariatric surgery, and sometimes they lose the weight, but they get like a little bit of the skin kind of stretches as well. Now, can laser be used for any of that? Is it more of a fat burning?
It depends on how much loose skin they have. Usually when people lose that much weight, they need a tummy tuck.
Okay, tummy tuck. But the fat burning part of it is, we hear a lot of commercials. I got to always say, you know, what I hear in the general population is you hear about that cool sculpting or fat burning, but you can use a laser to burn fat?
I like sculpture better than cool sculpting. I used to have cool sculpting, but what I didn't like about cool sculpting was that you would freeze the fat, and sometimes you would have more loose skin, because when you use freezing technology, nothing really happens to the skin that would enhance skin tightening. So the reason I like sculpture better, which is a laser that melts fat, is because in addition to melting fat, you have some pretty good skin tightening results with it also.
Okay, and so for sculpting with the laser, the way you do it now, is that the stomach area? Can it be under the arms,
it
flat?
Can be pretty much anywhere where there's fat and loose skin. I also do laser liposuction, smart liposuction, where that's minimally invasive, where you do a little incision and melt the skin under the fat under the skin, and then you suction it out.
Okay. Now, do you see? I got to ask, because I'm a man. Do you ever see men come in for that?
A lot of men.
Because
yes.
We've kind of released the stigma the last few years. Men are getting pedicures and manicures.
I would say about 40% of my patients are men.
Whoa. Wow. That's good to know. Yeah, because I tell you, until a few years ago, I never got a pedicure, manicure. Now, I would never do it any other way.
That's right.
I cut my nails now because it's so good. But for something like that, that's good to know, because maybe 20 years ago, you didn't see much of that. Now you're seeing up to 40% of men. So, men, check out mdbeautylabs.com, because I know in South Florida, we got to look our best, whether we're on the beach or downtown West Palm or downtown Miami, taking the train back and forth as well. So I'm glad I asked about the laser surgery, but that's that can be done for the fat burning, but as well as, I guess, you can help with the things we hear about, like the wrinkles.
A lot of things: wrinkles, skin pigmentation, loose skin. A lot of different applications. Acne.
Oh, really?
There are lots of different technologies out there for many, many different things.
Do you see a lot of adults for acne? Because
yes,
some people can't get rid of it.
Yes,
like myself.
Yes.
I mean, it just sticks with you. I mean, it started like at 12 years old and it's still going. Like, you think it'd be gone, but
Yes.
Okay, so you can help adults with that. That's good to know as well. You also do injectables and fillers.
Yes.
So I know that has a lot to do with the face.
Yes.
And I've had a few doctors on here. I guess as the skin gets older and as we age, we lose a little bit of the almost like the structure, the puffiness.
Yes. So really, aging is two things. It's loose skin and volume loss. So what we achieve with fillers is replace in a very natural looking way the volume that's been lost due to aging.
Okay. And I'm looking at your website now, mdbeautylabs.com. There's so much information. You stay very busy. You offer so much.
I always try to stay up with the latest technologies and really be ahead of the curve. It's my passion. I love doing it.
Yeah, 3 offices, and then like you were just saying, so acne therapy, there's photodynamic therapy, chemical peels, medical skin care products. So photodynamic therapy, that's something that's also done right in the office, and I guess use a beam of some sort?
Yes, you use a combination of intense pulse light and a chemical to, for example, would be a great treatment for acne.
Okay. And BLU-U acne therapy, so that's blue U.
Blue U, it's a blue light that actually kills acne bacteria within the glands, the sebaceous glands.
Wow, and that wouldn't ever be taken out unless there's no other way than to just pick it out, which I unfortunately had to go through as a kid, where you'd go to the dermatologist and they'd use that tool. I hated that tool. But, wow, I'm glad I asked because I didn't know that you did all this for acne as well. Functional medicine, this is all on the website too, mdbeautylabs.com. So you do bioidentical hormone therapy.
Yes.
And then liver detox program. So do you help a little bit with people with drug and alcohol issues?
No, I haven't done much with that. No.
Okay, so liver detox
just in general detoxification to feel better.
Yeah, because a fatty liver can be a problem, especially with people maybe seeing you that are overweight.
Yes.
Or just if the liver needs to be cleaned out.
Exactly.
You do executive physical exams. That's good to know in the West Palm Beach and Palm Beach area. HCG diet.
Yes.
What is that?
ACG stands for human chorionic gonadotropin. It's a hormone that the female placenta produces when we're pregnant in large quantities. In a very small quantity, about 150 units a day. When you inject yourself, the patient has to inject themselves with 150 units of ACG a day. It's a very effective appetite suppressant without having the adverse effects that some of the other prescription appetite suppressor medications have. For example, bringing up your blood pressure or causing palpitations, making patients jittery. It's a very effective appetite suppressant without having any of those effects.
Wow, there's so much going on with your practice. That's great. Now, why we were kind of to circle back around to the neurotransmitter discussion we were having, telomeres, the NAD and IV therapy. Why are only a handful of physicians trained in this especially? And when you say a handful, do you mean globally, locally? Because I haven't heard of this locally, to be honest with you.
NAD again it's a very new thing in terms of that particular use of anti-aging. So a handful, what I mean by that, it has to be really somebody in terms of being a physician who's open-minded to new technologies and new knowledge that really has not been learned in our training. And people that a little bit more open-minded to get away from mainstream medicine.
I see. Now, if there were any physicians or nurse practitioners interested in learning more about this, do you, I guess the word would be proctor them or
Sure,
teach them?
Yes.
Okay.
Yes,
so they can
absolutely.
contact you as well
Definitely.
and do that. That's good to know because I know you're a pioneer in this type of care as well. And now I see on your site you have men's services, so that's great. We talked a little bit about that. I'm going to go ahead and click it while it's going by. Wow, you do a lot there. People can request an appointment on the site. That's really easy. So for men, check this out, men. Massage therapy, which I love. Hair restoration, which I need. Freddie, she does hair restoration. We can get you in here and get you back on the beach so you won't get burned on the top of your head. Skincare, body contouring, we talked about that as well. Skin rejuvenation, laser
Fillers.
hair reduction for men.
Yes.
You can do that, the unsightly hair. You know, sometimes men, the hair grows, you know, in places that you maybe don't want to be seen on the beach as well. We've heard a lot that with women, but men as well. So that's good to know. I'm glad I clicked on that because it's, you know, you got men and women there as well. You also do, obviously, a lot of cosmetic, permanent makeup. I've heard a little bit about that. Is that actually almost like a tattoo in a way?
Tattooing, yes. Eyeliner, eyebrows, lipstick or lip liner.
Okay. And I know women get that a lot as well, but men it's open to as well. What is, I may be getting this wrong. I didn't click on this earlier. Latisse, Latisse.
It's actually a medication by Allergan, the same company that produces Botox. Mm-hmm. And it makes your eyelashes grow. Okay. It's a clear liquid that's applied to the lash line, and it makes eyelashes grow.
Now, platelet-rich plasma therapy, PRP injections. Tell us a little bit about that, because I've heard it explained in so many ways. Is it blood your own blood that's taken out of your body, spin in a centrifuge?
It's your own blood that's taken out of your own body, just as if you were to draw a tube of blood, and you spin it down and you separate out the layer in that blood that's platelets and your own growth factors. And you re-inject it right away, whether it's in the face as a filler to stimulate collagen production or in joints for arthritis. Mm-hmm. It's a pretty effective treatment.
And that's much quicker than, like, say, an NAD IV therapy.
Yes, that's much quicker.
That's something that can be done within an hour?
Definitely.
On a lunch break?
Yes, absolutely. That only takes a few minutes.
And where can you inject that in the body? Anywhere where there's an ailment?
Anywhere where you want growth and repair. For example, in the face to produce collagen. It's also being used for hair regrowth, to inject it straight into the scalp.
And it's safe.
It's very safe. It's actually one of the safest things that you can do, because it's your own product. It's your own body product. Nobody can be allergic to it.
You're not introducing something that's man-made. It's your own body that produced it. Wow. And I guess doctors, they're trained into separating that plasma, like you said, as well. And it's actually a centrifuge in the office that spins?
Yes.
I got to see this in person. I have to stop by and see it in person.
Please come by.
Definitely. You have 3 offices, so I'll have to make it. Would you stay for the last segment? I mean, would you be nice enough to do that? I don't know if you have to go, but we have 15 more minutes.
Okay.
Okay, because I have a couple more things I want to ask you about as well. Let's take one more break on the You and Your Doctor show, and we'll come back and wrap it up with Dr. Daniela Dadurian with mdbeautylabs.com.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
We're back with Dr. Daniela Dadurian with mdbeautylabs.com. We've talked to Dr. Dadurian about a whole bunch of topics today, but if you ever want to take a look at this show, maybe there's something that you missed that you want to learn a little bit more about or go back, you can go to allcountyhealthcare.com. All the radio shows are right there, or on their Facebook page. It's All County Healthcare INC. Just put that into the search browser, and all of the shows are there as well. So thank you to them for sponsoring the show. They are a Medicare certified home health agency. So if you have any questions, like the commercials say, give them a call or go to allcountyhealthcare.com. Toll free, they're always available at 1-888-717-7170. So thank you to their team, to Maddie and Lou and the team there, John Kelly, Peter Kaplan as well, and Isadola, who's a just newest team member for the little bit of the Miami area that I know. So always check them out for home health care, Medicare certified home health agency as well. They're great for sponsoring the show, so we can take the latest and greatest in health and give it to you twice a week right now. So we're going to get back, though, with Dr. Dadurian. Now, she specializes in NAD and IV therapy, which we talked a long time about, achieving healthy longevity, just helping with cell repair, which is so important in the aging process, from youth to adult to elder as well. So that's really important. One of the things I wanted to ask you about, Dr. Dadurian, that I saw on your website, but I don't know much about, and I didn't know if it was in the butt lift area or the other area, but what's a Y lift? I've never seen that before.
Oh, Y lift is a very new, exciting technique to inject fillers in a different way, not a traditional way of injecting fillers in the face, in order to achieve almost facelift type effects. It's basically a technique where you would use a cannula and inject the traditional fillers, Juvederm and Voluma mostly, along the jawline, along the cheekbones, to achieve a very nice volumizing natural look. It takes about 30 minutes. It has no downtime. It barely has any bruising or swelling. And it's quite an impressive result.
30 minutes, it can be done on people's lunch break.
Yes,
as well.
Absolutely.
Or Saturdays. I just saw on your website, there's so much information here. I'm always amazed. I always tell the listeners and viewers, there's some great doctor websites out there, but mdbeautylabs.com, you have so much information. It's an educational tour when you're on here. But I noticed just during the commercial break, you're open on Saturdays in West Palm Beach and Saturdays in Palm Beach as well. Is that right?
Yes. That's right.
Wow, so that makes it so much easier because some people have busy work schedules and they can barely even get a few minutes for lunch. And
yes.
Saturdays, things kind of open up for, most people. And they can make an appointment with you in West Palm Beach or Palm Beach as well. So that's kudos to you for opening up on Saturdays. How do you do that? And you look, you look great, and you have a ton of energy. I mean,
it's all my anti-aging treatments.
Yeah, you're the greatest spokesperson for what you do, because and working Saturdays is tough. I work a Saturday here and there, and I'm just wiped out. But you're very dedicated too. I mean, you have so much going on in terms of wellness and health and holistic medicine. That's right. You sure do. I felt that right away when I talked to you on the phone, so I'm glad you came all the way down here to the show. But we're on globally with Facebook Live. You know, we have a few people. My cousin watches it in London, and she says it's like 1 a.m. there. So that's cool. And I know we had a doctor on once. His son was watching in London, so that kind of feels good, you know. And I know we have a few listeners in New York City as well, because we had one call into the program splitting time between Boca Raton and New York City, which happens a lot around here. I was just going down through the services, but not only all these services from acne therapy all the way to the, you know, the Y-lift, the injectables, the fillers, the health and wellness, the hair restoration, which I'm definitely interested in, the PRP therapy, but IV vitamin therapy. There's educational blog on your website as well. You do specials and events as well, so maybe people can save up, you know, what works for them as well. There's videos, photo gallery. I was going to ask you to take us on a virtual tour through your office, but I realized you have a tour tab on there as well.
Yes.
And people can shop online. You even do gift cards as well, different times of year. So maybe if someone's having a birthday or a graduation from college or graduate school, or, you know, holidays as well, so you can help out with that as well. You even have a tab for parking. You really thought it out. And careers, which we talked about, because I imagine a lot of people are going to be calling you up to get involved. And Dr. Dadurian's on Facebook, Google+, LinkedIn, Twitter as well. Let me give out your information again. So it's mdbeautylabs.com, 561-655-6325. Is that the
That's
main
correct.
number?
Yes.
Okay, because I know you have a few numbers. But once again, you're in West Palm Beach. You're at 320 South Quadrille Boulevard in West Palm Beach.
Yes.
Then also in Palm Beach, 340 Royal Point Sienna Way, Suite 325D. That's on the island of Palm Beach. And then you were telling me the third office is 1000 North Olive Avenue.
Yes.
And that's West Palm Beach. I know exactly where that one is.
And that one is actually called, that location is called BioAgeMD.
BioAgeMD.
Yes.
I'm going to jot that down. That one's for anti-aging.
Yes.
And you were telling me the Palm Beach is cosmetic.
Yes.
And the Quadrille Palm Beach location, Quadrille Boulevard, is minimally invasive and cosmetic as well. And that BioAge, did I get that right?
Yes.
Okay. Let me ask you a little bit about I know you're so dedicated to your practice and your patients, but what are your hobbies and passions in life outside of medicine? Do you have time to get involved in maybe something that takes your mind off medicine, or is that your...
I love to read and I love to travel.
Oh, okay.
And really any free time I get, I travel with my family.
Oh, nice. In the U.S. or world travel?
World travel.
Oh, yeah. Where are some of the places that you've been that maybe,
Africa, Asia.
Whoa.
I'd love to find exotic places to go to.
What was your favorite trip?
Probably safari in Africa.
Whoa, okay. Whereabouts?
I've recently been to Egypt too, which was absolutely magnificent.
I haven't been to either of those places, but I'll tell you where my favorite trip in the world was. I once went to Florence, Italy, as Firenze.
That's beautiful.
In Italy, and trying to get back. I was there when I was 12 years old. So I'm always trying. That's my goal in life. I get back. My wife wants me to take her to Australia. I've never been. But I'm doing some traveling later this year in the U.S. I'm going to Seattle, which is going to be a big trip. Mm-hmm. So I'm really happy about that as well. Well, we've got a lot of info out, but like I said to everyone, check out the videos on allcountyhealthcare.com. I know we only have a couple more minutes, so I want to we're down to 1 minute. See, I told you it was going to be over before you know it. That's what you tell us, but, that's the way it is. So take the time, men and women. I think that's important, because we're in South Florida. We want to look our best. And, doctor, with your training.
Our best.
Yeah, and feel your best. And you did an internal medicine residency and training right at the University of Miami Hospital. It's on the tip of my tongue. Jackson Memorial, which we always have doctors on. But so you have that background to be doing injectables and IV therapy. So that's so important. So thank you again for making the drive.
Thank
Dr. Daniela Dadurian, MDBeautyLabs.com, 561-655-6325. Take the time to check her out. Thank you and have a good night.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.